Hey there, welcome to another episode of the Health Tech News brought to you by Medicine Tech. Of course, my name is Glory. I'm your presenter, and today I'm excited to welcome you to another episode. I have interesting updates for you, but before we get into the full details, let's catch the highlights. Singapore is building trust in AI for patients' care. Kenya is transforming maternal and chronic care through digital health. And finally, AI in healthcare, the new stethoscope. First on the news, Singapore is building trust in AI for patients' care. Singapore has decided to take a lead in showing how AI can transform the healthcare responsibly. Rather than rushing AI tools into hospitals, the cities, hospitals, startups, research institutions, and government agencies have decided to collaborate from the outset. The first test innovations in controlled sandboxes before building inclusive data sets alongside clinicians and regulators. So here are 5 concrete ways that Singapore has translated its leadership in AI into practical, responsible healthcare solutions. The first is regulatory sandboxes. Singapore has created regulatory sandboxes, which are control spaces where AI tools can be trialed before they reach real patients. The second is hospital pilots. Singapore's healthcare institutions are actively integrating AI into clinical settings to address real-world challenges. Third is cross-sector collaboration. Singapore's approach to AI in healthcare is characterized by robust collaboration among hospitals, startups, research institutions, and government agencies. And the last is sharing lessons regionally. Through the Asian AI Health Working Group, Singapore has played a pivotal role in developing guidelines for the ethical use of AI in diagnostics and hospital management. So, all these 5 initiatives are put in place to ensure that AI are used responsibly in healthcare and are safe for patients. And that makes a lot of sense. How do you think Africans can learn from this roadmap? You can share in the comments. All right, let's move on to the next update. Kenya is transforming maternal and chronic care through digital health. Now, in this particular update, I'm going to be sharing different ways that Kenya has recently been transforming maternal and chronic care through digital health revolution. In Kenya, digital health is no longer a futuristic concept. It's a growing reality that is now reshaping how care is delivered, especially for mothers and patients with chronic illnesses. At the heart of this transformation is Prompt, an AI-powered maternal health platform developed by Jacaranda Health. Now, this is how Prompt works. Prompt uses two-way SMS messaging to guide women through pregnancy and postpartum, offering timely advice, reminders, and even providing support when risks are detected. This prompt has made so much impact in Kenya, and there have been several reports about its use and importance. Maria, a nurse manager and an earlier adopter of Prompt, recalls how the system helped her both as a caregiver and a mother. According to Maria, I received prenatal exercise tips, nutrition advice, and even simple pain relief suggestions like placing a pillow under my legs, all via SMS. Well, that is incredible. Now, Maria is a vocal advocate for digital health, emphasizing its role in improving maternal outcomes. That's about Prompts, but there's still more to this news update about Kenya. Kenya is now making bold moves to digitize its entire public health system. Through the newly established Digital Health Agency, the government is distributing 74 computers to over 15,000 public hospitals worldwide. Now, that is huge, and I love this already. To the interesting part, this rollout supports the shift from paper-based records to electronic medical records, enabling real-time data sharing and better patient tracking. Again, this is really, really huge, and I love the fact that countries in Africa are embracing electronic records. I mean, I've shared a lot of updates around this from different countries in Africa. So well done to Kenya for embracing digital health. According to Kenya's Health Cabinet Secretary, Aden Duale, we're embracing digital health to boost access and enhance social inclusion. Now, this initiative is part of Kenya's broader universal health coverage strategy, which includes telemedicine, disease surveillance, and resource allocation tools. Still on Kenya. Talking about telemedicine in Kenya, Murang'a County is leading the way in telemedicine, especially for patients with diabetes, hypertension, asthma, and other chronic illnesses. Governor Irungu Kang'ata launched a pilot program connecting 44 health facilities to virtual consultation platforms, and over 15,000 patients have already been registered. According to the governor, patients no longer need to travel long distances. They can consult specialists remotely, access medications locally, and receive follow-up care at nearby clinics. He also mentioned that the county is also exploring drone technology for transporting lab samples and medications to further decentralize care. All of this from Kenya. With this, you will agree with me that Kenya's digital health journey is a powerful example of how technology can bridge gaps in access, equity, and quality of care. From maternal health platforms like Prompt to county-level telemedicine pilots and national infrastructure updates, Kenya is building a future where healthcare is smarter, more inclusive, and closer to home. So for every African country that is not really embracing digital health, this is a reminder that you have a long way to go. Join Kenya in making healthcare accessible to patients at population level. So I've spoken a lot about Kenya and how they are doing, amazing things to transform their healthcare industry to digital health. Let's take the last update for today. Can we now say AI in healthcare is the new stethoscope? Let's get to find out. South Africa is facing a serious cardiovascular health crisis, and artificial intelligence is stepping in as a powerful ally in the country's evolving digital healthcare landscape. With only 200 cardiologists serving a population of 63 million in South Africa, access to specialized heart care is severely limited. And of course, from these statistics, you can easily agree with that. Dr. David, a former president of the South African Heart Association, described the situation as a tsunami overwhelming both public and private healthcare facilities. Well, the problem is not just about the geography. Urbanization, fast food culture, and rising stress levels are now pushing conditions like hypertension, obesity, and type 2 diabetes into younger age groups. According to Dr. David, we are now seeing heart disease in young adults. This is a generation that should be at its most productive. Well, I totally agree to that. Now, to the question about AI being the new stethoscope. AI is increasingly being seen as a modern-day stethoscope because it is capable of detecting what the human eye might miss. It can interpret ECGs, analyze smartphone health data, and help triage patients in busy clinics. This means with AI, there is early detection of diseases, better support for overworked staff, and expanded care in under-resourced medical facilities. So would you also agree that AI could be the new stethoscope? Well, according to Dr. David, like the stethoscope 200 years ago, AI makes the invisible visible. So let's just say that Dr. David has concluded this, whole question for us. AI can indeed be the new stethoscope. From all indications, it is really providing a great support to healthcare delivery across the world. A very close example is this. South African tech firm Blue Networks and Infrastructure, BNI, recently visited WAI's innovation campuses in China, where they saw how 5G-powered telemedicine and smart hospital systems are transforming healthcare delivery. And back home in South Africa, the Heart Association piloted AI-enabled heart screenings at the Bara taxi rank in Soweto. And for many taxi drivers, it was their first ever heart check without having to go to the hospital. So this is a powerful reminder of how technology can bridge access to healthcare. So AI is not here to replace doctors or healthcare practitioners, because clinicians are still the ones to bring empathy, experience, and judgment to healthcare delivery, right? But they are here to support and make healthcare delivery to be more easy and accessible. So yes, AI could be the new stethoscope. And that's it for the news today. I hope you had a great time catching up on all of these updates. Do well to share your feedback in the comments. To ensure you don't miss out on all our news updates and other opportunities we have for you in the health tech industry, do well to follow us and turn on your notification so you do not miss out. Also, if you're looking to build your career in the health tech industry, you should follow us on LinkedIn at Medicine Tech. Once again, my name is Glory. Thank you for joining this episode. See you soon. Bye.